Here we'll talk about postmortem lividity, which is also called as livor mortis or postmortem staining or hypostasis, mbbs or surligations. You'll get to know more about it later, why it has so many names. So what is postmortem lividity? What happens when a person is dead? He's made to lie in a supine position. So because he is dead, the body stops to function, right? There will be no muscle contraction, there will be nothing. It's just there will be toneless capillaries and veins. So because of the gravitational force, the weight of the body falls on the lying position. When he is lying on the supine position, the whole weight falls on the back of his body because of the gravitational force. So the blood goes towards the ground. That means it settles in the dependent parts of the dead body. So postmortem staining is a bluish or the purplish red discoloration resulting from the gravitational force. Settling of blood is seen in the toneless capillaries and venules of the dependent parts of the dead body. So mechanism, how this happens? It is because of stagnation of blood after death. Because after death the ATP cannot function, the muscle cannot contract, the blood cannot move further. So there will be stagnation of blood. This collection of blood in the capillaries and veins due to the gravity, again the gravitational force, the weight of the whole body falls on the back of the body. When the person is lying down, it falls on the dependent part of the body. So there the blood collection happens in the capillaries and veins due to the gravity. For the first 30 minutes to 1 hour, the discolored patches on the dependent parts of the body occur, which are in 1 to 2 centimeters in diameter. Later, in 3 to 4 hours, these patches unite to form an extensive discoloration. Then the whole body is discolored. So it takes 5 to 6 hours to complete the whole process. So uniformly stained by the end of 5 to 6 hours. Here we have two scenarios. After 5 to 6 hours, we have two scenarios. Again, after 8 to 12 hours, we have two scenarios. So let us look at after 5 to 6 hours. The first scenario is if the body is disturbed. The body is lying in a supine position. It is shifted to side position. The body is disturbed. Then the lividity also reappear at the newer side. So the second scenario where the body is undisturbed after 5 to 6 hours. It will be same, right? Lividity do not appear at the newer side because the body is not disturbed. It is at the same side. The body is at the same position. So why will the lividity occur at the newer side? We come to the second case where the body is disturbed after 8 to 12 hours. So what happens in the time of 8 to 12 hours? Fixation happens. That means after 8 to 12 hours, even if you disturb the body or undisturb the body, there will be no change. Because the fixation has already happened. So reasons for the fixation of lividity are due to capillary action. In the dead person, the blood cannot pass easily through the vessels, and also rigor mortis sets in. So when the rigor mortis sets in, the muscles becomes contracted, the muscles are destroyed. So vessels that are passing through the muscles are also destroyed. Compression of the vessels in the newer area. So these are the three reasons for the fixation of lividity. One is due to rigor mortis, second is due to capillary action. Because in the dead person, the capillary action is poor. The blood cannot pass easily through the vessels, and compression of the vessels in the newer areas. So this is the graph. From the staining starts within 2 hours and it follows till 4 hours. It gets completed in 5 to 6 hours, and the fixation occurs at 8 to 12 hours, and it will be constant after the fixation. Points about postmortem lividity: it is an intravascular phenomenon and it occurs only on the dependent parts of the body. According to the different positions of the dead body, the lividity is occurring at different sides. So if the person is hanging, the whole weight falls on the dependent parts like hands or feet. So you can see this glove and stock lividity. The lividity is seen only in hands and feet. And if the person, again, as we said, is lying in a supine position, the lividity is seen on the back side, posterior side, like neck, thorax, buttocks, posterior thighs and calves. If it is lying in the pronated position, then you can see on the anterior part, like front of the chest, face, eyes, etc. So if it is lying on this one side, the lividity is seen on that side. So what are mbbs? If the dead body lividity sets in, if the dead person was wearing collar around the neck or waistbands or belt, there you can see this pale bands. So what is contact pallor? If the body is lying in contact with the floor, the part which is attaching to the surface show blanching. That means it shows white color. The rest of the body shows red color or purplish red color because of the lividity, where the parts of the body which are attached to the surface below, it shows blanching. That is contact pallor. Just the same phenomena is applied even in mbbs. If the waistband or belts which are tightly wrapped around some part of the body, there you can see pale bands, but rest of the body you can see lividity, which is purplish red color. So postmortem staining occurs in the dependent part of the internal organs also. That's why it is called as hypostasis. Now we can know the meaning of different names: postmortem lividity, postmortem staining because it is staining in the bluish purplish reddish color, livor mortis, hypostasis because of the internal organs are also getting stained, and mbbs we have seen. So if the heart, it is misinterpreted for myocardial infarction, and in lungs it is misinterpreted for pneumonia. Intestine, it is misinterpreted for strangulation. Normal color of livor mortis changes from red to purple as the oxygen dissociates from the hemoglobin in the RBCs. Normal functioning body, the RBC along with the hemoglobin and oxygen is red in color. But as the person is dying, the oxygen leaves, right? So now this new thing which is formed is deoxyhemoglobin. Because oxygen left the hemoglobin, that's why deoxyhemoglobin, which is purple in color. Postmortem lividity normally appears purplish. So factors affecting lividity. One is position. Obviously, the position, if you frequently change the position, the body cannot fixate, right? So it is important for the body to stay in a particular position for the postmortem lividity. If not, fixation will not occur that fast. Hemorrhage or hemorrhagic shock or anemia. See what happens in anemia, there will be less blood, right? Less hemoglobin and less RBCs. So because of that, you cannot appreciate that discoloration. In hemorrhage, there will be blood loss again and hemorrhagic shock. These are the conditions where the blood loss or RBC loss is happening. That's why you cannot appreciate this postmortem lividity. And complexion. Again, this lividity, discoloration of the skin is seen more in fairer skin people when compared to the dark skin people. And cold storage. If you keep the body in the cold storage, fixation occurs, but it occurs after a longer time. Staining will also help in determining the time since death. This process is called as calorimetry. Remember it. So what is the fate of lividity? What happens? So after some time it merges with the putrefactive changes. So colors of postmortem lividity. Normally we all know because of the deoxyhemoglobin, it is purplish discoloration, and in case of carbon monoxide, C correlate with cherry, right? C stands for cherry. So it's a cherry red color. Cyanide, it's pink in color. In phosphorus, nitrates, chlorates, you can see brown color. Chlorates, again C stands for chocolate brown. Nitrates are in nitrates, you can remember with reddish brown, and phosphorus, it is dark brown. So phosphorus is always dark brown, you can see that clearly. And hydrogen sulfide, bluish green. Aniline, deep blue. Opiates, black. So what is the medical legal importance? Postmortem lividity is a sign of death, and you can estimate the time since death also, which is by the method known as calorimetry, and it indicates the posture of the body at the time of death, right? So the cause of death can also be known. If it is because of the chlorates, it can be chocolate brown discoloration. If it's because of the CO, then you can see this cherry red discoloration. So it determines the cause of death also by distribution on the color. So it may be confused with myocardial infarction, pneumonia and the strangulation because hypostasis of internal organs. Because of this postmortem staining, the internal organs which are in the dependent part of the body also get stained. That condition is known as hypostasis, right? The hypostasized heart can be confused with myocardial infarction. Again, the lungs can be confused with pneumonia. Intestines can be confused with strangulation for the hypostasis of internal organs, right? So this is an important point. And also in early phase of its formation, it may be confused with bruises. Within 30 minutes to 1 hour, we have said there are only 1 to 2 centimeters in diameter patches are seen all over the body. These patches can also be confused with bruises. This is about postmortem lividity. Bye.